Hi everyone, welcome to Center of Balance Live. I'm Szenan from Center of Balance, the acupuncturist. Today's topic is UTI diagnosis. UTI diagnosis. Now, before I really start the topic, I would like you to do one thing for me, which is please say hi to me and leave some comment down there, whether you're on YouTube, the channel, or you're on Facebook Live, or you are on Instagram. Once you say hi to me, please give me a thumbs up and share this live video with your colleagues, family, or your friends. Thank you. And I'm now going to my personal account of Instagram and do a live. There we go. Just go there. Now I just got back from Mount Ruapehu the night before. Yes, the night before. We went there for snowboarding. It was fun, and of course, you fall and you hurt yourself. Then it's not a big deal because I can go back to clinic and get a colleague to help me for recover from my injury. Well, acupuncture is phenomenal for pain, for injury. I actually hurt my neck over here because I had a fall. Then, all right. Oops. Just try it again. Okay. Now, let's start to talk about UTI diagnosis. UTI diagnosis. So how do you ask a doctor diagnose UTI? So first, we base on symptoms. What sort of symptom? Like bleeding in urine, pain and burning while you're passing urine. So those are the symptoms of UTI. And pain in the abdominal or lower back, those are the symptoms. So once you have those symptoms, you go to see a doctor, and the doctor they will review the symptoms. Then, wow, okay, this looks like UTI. Then what happened? They're going to perform physical examination. What physical examination? They probably palpate your tummy, lower abdominal. So there's tendon there. Then to really confirm a diagnosis of a UTI, your doctor will need to test your urine. So do a urine test. For the urine sample that you give to your doctor, it needs to be a clean catch sample. So what is clean catch sample? So when you pass your urine, you need to catch the middle of your urinary stream rather than the beginning. Right? So why is that? Because this helps to avoid collecting the bacteria or yeast from your skin, which can contaminate the sample. So your doctor will explain to you how to get a clean catch. But that's not all the case. Some doctors didn't tell you at all. Because I took my friend to the emergency department, ED. and the nurse, the doctor just hand you a cup and say, go and pee. We're gonna get the urine sample, but they didn't actually explain how to get a clean catch. Well, if you if you watch this live video, you know it. You only get the middle of your urinary stream if you want to get a urine test. Okay, this is important. So when testing the sample, your doctor will look for a large number of white blood cells in your urine. Why is that? Because when the white blood cell increase in your urine, this actually indicates an infection. So when there's infection, your white blood cell will increase. Right? So white blood cell is an immune system. White blood cell increase, and white blood cell can damage the white virus or bacteria or fungus. Okay, so your doctor will also do a urine culture to test for bacteria or fungus. Okay, the culture, the reason we do culture is to find out what type of infection, to identify the cause of the infection. Why is that? Because your doctor will be able to tell you what sort of antibiotic to use for your UTI will be best for you. Does it make sense to you? So if a virus is suspected, special testing may need to be performed because viruses are real cause of UTIs, but can be seen in people who have had organ transplants or who have other conditions that weaken their immune system. So virus is more difficult to deal with because by using antibiotic, it doesn't work with virus. Right? You need to use your own immune system to fight with virus. Right? What about for we talk about those just now? We talk about the urine sample. It's actually mainly for lower tract UTIs. What about upper tract UTIs? If your doctor suspects that you have an upper tract UTI, apart from urine tests, they may also need to do a complete blood count and blood cultures. Why is that? In addition to the urine test, you need to do those two, which is complete blood count and blood cultures, because a blood culture can make certain that your infection hasn't spread to your bloodstream. And this is important. If the bacteria spread into bloodstream, it is dangerous, very, very dangerous. Okay, so therefore you want to do a full, complete blood counts and blood culture, right? For that. What about recurrent UTIs? Recurrent means it happened again and again and again, a lot of time, very frequency, very often. if you have recurrent UTIs, your doctor may also want to check for any abnormalities or obstruction in your urinary tract. Mean you may be born with your urinary tract structure abnormal. So the structure abnormal that causing the UTI, recurrent UTI. So what happened is, in this cases, apart from urine test, apart from blood test, and the urine culture and blood culture, further on, your doctor will suggest an ultrasound, right? So, or CT scan, or cystoscopy, which means is put a camera into your urethra and up into your bladder and have a look at the inside. And this during cystoscopy, your doctor may remove a small piece of bladder tissue and test it whether to try to rule out the bladder inflammation or cancer as a cause of your symptoms. So further testing, it need to be done if it is a recurrent UTI. Okay. Or it may give you an X-ray as well, and the X-ray during this in this cases, and they have to inject the dial to highlight your urinary tract on the X-ray image. This is all to help to actually look at whether there is any abdominal structure of the urinary tract organs. Right? That's it for today. So I hope that this help you can actually give you some idea how UTI is being diagnosed. And more common thing is, everyone know it, is go and get a urine test to be able to certain and confirm whether those symptoms are from UTI or not. But remember, to get a urine test, you want a clean catch, which is you get the middle part of your urine, not the first part. You want to avoid the first part. So you pee a bit first, then you pee the middle part into the cup, and then give it to the lab, right? I hope that all makes sense to you. So, hi Veronica, how are you? Yes, midstream urinary sample. That's right. No problem. All right. This is the main one, okay? Because people tend to forget about. And again, I took my friend to the hospital to test the urine, and they didn't tell her. Okay, they didn't tell her to catch do a clean catch. That makes it different though. It does, okay, because the first part of the urine it touches skin, and you don't want those because it can be some other bacteria in the outside of the skin, right? Rather than exactly from the inside of the urine. Okay, you want to know the inside urine, the bladder one, right? Okay, stay awesome, and I love you all, and I'll see you tomorrow. Thank you. Bye bye.